position of the cephalic vein as well. So over here, the people don't have very thick forearms. I find it quite difficult to specifically point out which vein am I scanning on. Like there are now 6 veins or more over here in the arm. Is there any trick specifically to how to locate or label the name the vein which I am exactly working on?
Sure. Yes. So here,
Wonderful question.
in our protocols, not a lot of people scan the forearm, but when we do, some of the things that I keep in mind is that if you have the patient in the anatomical position, so basically with the arm down and the thumb pointing laterally, so let me stand there. I go away. But basically the idea is that if you're standing in front, but I am facing you, in the palms of your hands are facing forward. Your thumbs are going to be pointing laterally, right?
Yeah, exactly.
So the thumb is going to be your guide for the radial vein and artery, and the pinky finger or the fifth digit will be your guide for the ulnar vein and artery. So if you scan along that area of the forearm, you should be able to see the artery first. Most of the time, the artery will be more visible just because it doesn't compress. And then once you find the artery, that's the best landmark in terms of finding the vein adjacent to it. If you still cannot see the vein, I would keep an eye on the pressure, because it doesn't really take much pressure to compress them. So perhaps release some of the pressure and add more gel. So you almost have like a bed of gel in between the probe and your skin. So you're barely pressing to actually see that. What else? Also in the anatomical position, you're going to have that the cephalic vein, the superficial vein, the cephalic, goes down the lateral aspect, so along the side of the thumb. So if you go below the elbow, along that side, you should be able to also follow it. The thing is, this is a little more difficult because there's no artery next to it, as you know. It's just the vein alone. What else? Something else that you can try, I haven't tried it myself for the forearm, but I've tried it for the upper arm, is to apply a bit of a tourniquet. So you know when you draw blood, so you can put it at the level of the upper arm, and so that creates some obviously blockage to the venous flow. And so anything below that, the veins will pop up a little more. Once you see them, then you can let the tourniquet go, but at least you know the area where you are. But I think that the easiest way to find them in the forearm would be thumb for radial, fifth digit or the pinky finger for the ulnar, and finding the arteries for the
Any other questions? Thank you. Any other questions? This is one of the doctors here that works for Lisa Lab. Yeah, here you go.
Okay. Hello.
Dr. Alia Kamal, and it was a nice session. We tried and learned a lot. My question is, in case of any thrombus or blockage, what's about collaterals, where we have to see the collaterals?
The collaterals. Okay.
Yeah,
Okay. So as you know, the body is able to create collaterals fairly quickly and pretty much almost anywhere. It's difficult for me to tell you where, because it will depend on the location. But if you see, for example, that there is an occlusion and there's still flow below the occlusion, so let's say the occlusion is in the subclavian vein, and you're looking at the axillary. If there is flow in the axillary, then that means that there is collateral going. And the presence of the collateral, even though you may not be able to see this, sometimes they're quite small. The fact that you will be able to see flow going tells you that there are collaterals, number one. Number two, the flow is not going to have a respiratory variation because there won't be a direct communication between that spot, between the axillary temple and the heart. And so you're going to have flow, but it's going to be almost like the portal vein flow, very flat. It doesn't change, no physicity. And at least here in North America, we're not too concerned about the collateral because, like I said, there are too many, and sometimes they're small. The main thing in that example is that you found the occlusion and you found the clot, and that you're showing that if there is occlusion, that there is a difference in the flow, proximal and distance to the clot. I hope that makes sense.
Any other questions? Any other questions? Any other questions? No? We're all done? Dr. F, any questions? I'll just flip this over. Hi, Leo. Finally.
Hello.